very low levels that are even lower than the ever-decreasing deaths as we achieve an AIDS-free generation. We cannot be shy about the implementation challenges, including those well beyond the reach of medicine and health providers. We must be clear that only countries can lead their own strategies and programs and increase funding over time, while the rest of us support their important work. To achieve maximal impact, a public health approach is required, focusing on high transmission geographies and high-risk populations. Strategies will be country-specific and, in fact, will be different from region to region. Stigma and discrimination against high-risk groups, including men who have sex with men, sex workers, and those who use intravenous drugs, must be overcome to end the epidemic. Sex abuse and gender violence, lack of inheritance rights, and many other social barriers stand in the way of success. Getting people at risk to enter and stay in lifelong prevention programs requires both the health and non-health sectors to fully participate. Persons living with HIV, community-based organizations, and the private sector are essential. But so are faith-based organizations that provide 30 to 70% of healthcare in Africa and can either pose challenges to us or actively promote the health of their congregations and must be welcomed into the HIV community of support. To achieve the goal, of course, health systems must be created and strengthened, political leaders must embrace the end to the epidemic, and resources, international and domestic, must be mobilized and maintained. Now, some might focus on the triple threats we just discussed of political will, implementation barriers, and resource mobilization, and want to temper the call for an end to the epidemic. But haven't we heard that all before? If we're going to be evidence-based, let's look at the historical record. When global health and development politicians said a global fund wasn't possible, the Global Fund to Fight AIDS, Tuberculosis, and Malaria was created and has provided nearly $23 billion to support programs in 150 countries. While the United States is the largest funder, the vast majority of resources come from Europe and Japan, and that's global solidarity for a truly Fond Mondial. While some believe that partisan politics in the United States would prevent a sustained commitment, President Bush launched the President's Emergency Plan for AIDS Relief, the largest international health initiative in history for a single disease. That's pretty remarkable, the largest international initiative in history for a single disease. It's committed $44 billion with strong bipartisan congressional support, including from people like Congresswoman Lee. President Bush set new standards for global health and HIV that included a shift from paternalism to partnership, a results-based approach, good governance, and the active engagement of all sectors. The Obama administration has capably picked up and evolved those foundational principles, and through the leadership of Ambassador Goosby, has maintained strong bipartisan support. In fact, across administrations and changes in congressional leadership, HIV and global AIDS remains a firmly nonpartisan cause.